Welcome to this edition of FM Live. I'm here with Eric Eisenberg of Rogue Valley Manor. Thank you for joining me today, Eric.
Oh, you're so welcome, Becky. It's a pleasure to be here.
It's really good to see you. I feel like I haven't seen you in a while. How are things?
Things are kooky. These are I. It sounds so cliche every time I type it in an email or talk to somebody on the phone when I refer to these unprecedented circumstances or unprecedented times, and it feels like something you just say now. But oh my gosh, is it ever just so different than what we ever have experienced before? And so there's really no way to figure out what you're going to do until you're actually doing it. And that's really been the experience of this whole thing for me right now.
Yeah, because of that, are you seeing that you're asking a lot of your operator friends, hey, what are you guys doing? What's working for you?
I'm fortunate to be on the AHF Board of Directors, Association for Healthcare Food Service. I'm also on the IFMA Healthcare Advisory Council, and so those uh, those networks really have me on several calls a week. And then, of course, I'm part of a larger organization, so I'm here at one community, but we have 16 such communities in our company, and so we have weekly calls amongst all of our facilities as well. And so it really, again, having these networks is so key to the successes that we've experienced.
And what are some of the common questions that people are asking or that you guys are trying to get your handle around?
Well, it really, initially it was, what are we going to do about staffing when the bottom falls out? And everybody was worried about losing their own staff. And now the conversation has turned to furloughing and how many people are we going to lose because, we don't have the business. And in acute care in hospitals, what I'm finding is that, we're hearing from folks that, their business is so off at the hospital level, not just in food service, but that hospitals are losing tens of millions of dollars every month, and uh, it's becoming a real concern about how they're going to maintain business as usual moving forward. And so so now we have all kinds of considerations to be made regarding staffing, about how we're going to keep staff, how we're going to change our business model. And actually, that was just a conversation I had this morning on a call that was really about how do we change the way we do business in order to keep people working and keeping people fed, when they are working. But really, that seems to be where the conversation has turned lately. And some supply chain concerns, we're hearing that mostly on the East Coast. Here on the West Coast, not as much. We're not kind of experiencing that. Um, of course, I'd say the one common thread in supply chain challenges is disposables. Obviously, with the entire world being takeout right now, it's really hard to have a consistent flow of those items. But those are really sort of the key issues that are top of mind right now. I'd say the key issue top of mind right now for folks is definitely the furloughing of staff.
Yeah. And I think one of the things that often gets, I don't want to say overlooked, but there's such the human side of what the hospitality industry does, and our employees, they provide that service for so many people. What has this experience been like for you, just on a personal level?
When I moved from acute care to senior living, one of the things that I said to everybody who asked me, why would you do this? Why the move? Why the change? And I had a couple of reasons. One was really, I thought the shift of the industry at large was moving to a broader hospitality model in senior dining that was appealing to me. But additionally, I really was feeling like very disconnected from the end user in my previous work. That I did a lot of administrative work, and although I still found ways to be creative as a chef and creative as an operator, and I enjoy the business administration aspect of my work, I really was not feeling very connected to the patient in the bed. That was my end user, not someone that I was really connected to. And I really initially, when I got here, and still do, really enjoy the connection that I have to my residents, and that I know most of them. Even I mean, I have 1,000 people that live here, and I know many of them on a very personal level. And I would say that this experience has brought us so much closer, and I'm so much more than just a dining director here. I can't tell you how many phone calls start with, I didn't get exactly what I ordered, and ended with, I'm here alone dealing with my husband or spouse that's at the end of their life. And these are such taxing times, and I just rely on what you're bringing me. Um, and it really has become a very close and emotional experience professionally, uh, and personally in a professional way. And then, of course, personally, as a human being, the fact that I have a job that is not in jeopardy, that I'm not in jeopardy of losing, and the fact that I have a place to go every day. While my wife, who did lose her job, is home with my kids, homeschooling them right now. It's just, it's a completely different, our lifestyle has completely changed. And I'm spending much longer hours at work, and they're home kind of just trying to live life without much connection to the outside world. It's really crazy. I would say here in Southern Oregon, I live very, we're kind of in a, it's not very, really rural, but it's kind of a rural area. And, we're between, sort of equidistant between San Francisco and Seattle. And we have a couple of, we have Portland, and Eugene, I guess not too far from us, but, the next closest really big city is San Francisco. And we're kind of in the middle of the, sort of, uh, sorry, I'm getting a phone call at the same time as this is happening. Uh, uh, we we're in the middle of the sort of the urban centers, and so the population here is smaller, and as such, our cases of COVID-19 in the valley where we live are fairly limited. I mean, the entire state of Oregon only has 2,000 cases as of today, which is a lot by some standards, and nothing by other standards. So we feel very fortunate from that perspective. But our residents here at Rogue Valley Manor are cloistered away for their safety, because we see what's going on in nursing homes and long-term care facilities around the country, and it's terrifying. And so people are, locked away, as it were, in their apartments and in their cottages and their homes. And we are delivering, every meal that they get comes from us. 3 meals a day, 7 days a week, delivered. And that's not always the case, because sometimes they're traveling, or they cook for themselves, or whatever it might be, and they can't go to the grocery store now. And so they're really relying on us as their lifeline, and it's pretty incredible.
And food is such a powerful statement in times of need and times of stress. And so I'm sure that bond that you guys have with your residents is only strengthened throughout this process.
With most strengthened, with some taxed, but yes, it's really been, the outcry of support and really love and generosity from residents that were taking such good care of them has really been, um, it's been life affirming, to be honest. It's really, you make choices in your life to do certain things, and this has been a really valuable, horrible but really valuable experience in many ways.
That's great. I know you talked a little bit about some of the operational changes you guys have made there to be able to feed all of your residents who are now in their homes. What else have you been doing to kind of meet this challenge and to meet the needs?
So really, delivery was something we didn't really do before. We operate a 50-bed, skilled nursing facility, which is essentially like an acute care hospital. Really no difference in that, other than we don't perform surgeries and stuff here, but it's a full skilled nursing, uh, And, so we're accustomed to tray service, and we do a tray line, or, much like hospitals do room service. And we have delivered trays, some a day, about 20 a day, outside of the skilled nursing facility and outside of our assisted living facility. So now to translate that to delivering all of our meals to all 1,000 residents, all of whom are here, by the way, because they didn't go anywhere. They're all here. It really was, we had to reinvent the wheel entirely in terms of how we operate our business. And that took a couple of weeks to really fully get fully engaged. And now that we've got the flywheel going, and we've also had to add and take away various um, uh, services, like we initially did beverage carts and dessert carts and such kinds of things. And we had to stop doing those because it became evident that we weren't practicing safe enough social distancing uh, by interacting with residents in the hallways. Even if we were 6 feet away, we found that people were kind of coming down the hall to greet us, or they were mingling in the hall to sort of gather around the activity that we were producing. So as much as that, we want to provide more and more services, we found it we were creating harm for our residents. So we kind of had to pull some stuff back. But what we did little by little was, we started delivering 3 meals a day only in our sort of main high-rise building for people who were on a meal plan that included 3 meals a day. And when because we have several different levels uh, of contracts that our residents have. Some get 3 meals a day, some 2, some 1. And so we were kind of deciding for them, well, we're going to deliver you these 3 meals a day, and we're going to deliver to you these 2, and you're going to get this one. And they didn't really have a choice in that. And now it's open season, like they can order whichever of the meals a day that they want, whatever they want. And then we deliver it within our delivery window. We've been working on things like meal kits for those people who are able to cook for themselves, because many have their own kitchens and homes that they can cook in. And so that's actually a work in progress. We started doing it, and it became, actually, we felt more difficult for the resident to sort of do the shopping and necessary to order the meal kit. So we kind of had to dial that back, and now we're kind of fine tuning that. But we feel like if this continues for as long as we think it's going to, we feel like that's going to be a very valuable addition for residents that cook for themselves. And I would say that this idea of delivery has really changed our business forever, because I think that we will forever be delivering meals now. On our campus, we've got these 3 high-rise buildings, one of which is our health center and assisted living facility. And we also have 310 individual cottages all over our 165-acre campus. So this idea of getting meals delivered has really become something that a lot of our residents are really enjoying, because many of them, in order to fulfill their contractual, it's not their obligation, it's really our obligation to them, but in order for them to take advantage of what they're paying for their meals, they have to come up here usually and eat in one of our dining rooms, which is nice if you like to go out to dinner every night. But sometimes you want to just eat in your jammies, in front of the TV. And although I'm sure everyone's ready to have that be over now, I think in the future, the option to be able to do that a couple of times a week is going to be something our residents want us to continue to do.
Yeah, absolutely. And I know that this idea of kind of looking to the future seems very hard right now, and there's so many questions that are not answered, but any kind of pathway forward that you guys are thinking about, or kind of when things start to loosen, changes or operational things that you want to keep going, like delivery, what kind of is the path forward for you guys through all of this?
Well, I think the path forward for us is going to be, and we're already talking about this within our organization, so it's not like we haven't thought about it already, is that we will some of our services are easy to restore. We can flip a switch and bring certain things back online. Other things will take a little longer. One of the things that we did when this thing first emerged was we closed all of our buffets and went to all a la carte dining. Like, you had to be served, and we created social distancing within the dining rooms. We spread some tables out, and did more with reservations to keep people not piling into the dining room all at once. And I really see us doing more with that in the future. If hopefully, I'd love. I'm not a fan of buffets. Let me start with that. And so it's been on my list of things to try to eliminate. Anyway, I feel as though it's epidemiologically speaking, as well as from a service standpoint, they're just not, my favorite. And I'd love to see us have a more defined service model that was based around people being served at the table rather than, picking through a buffet. So I'd love to see us minimize the buffets and maximize what we're doing from a service standpoint. Many of our residents enjoyed that for the few days that we were able to do it, and I think that we'll have some support to do that as we go forward. Certainly, delivery will be part of that. One of the things that we are bringing into our organization is a relationship with a third-party reservation program that will allow residents to make reservations via this app, and they can also order food through the app. So that's going to, I think, revolutionize the ways we do some of our business here. And then what I do know is that it'll be a slow burn. We'll bring things back little by little. We'll open up one venue at a time. We'll probably make it all, we do some walk-in business now, and we'll make it all reservations so that we know who's coming when, and we can staff accordingly and seat people accordingly so that we don't get the kinds of mass rushes we typically get, right at the beginning of meal service and so on. And it really it's been again, the silver lining of this is it's given us a little bit of room to take a step back and look at how we do things so that we don't always do what we've always done just because we've always done them. And that's really been, I think, a real benefit, and ultimately will be a benefit to our residents, who will be the beneficiaries of the efficiencies and the improvements that we make.
And on that note, I will thank you for your time and your wisdom and your insights. Thank you for that, everything that you're doing, and for speaking with me today.
Well, thanks for inviting me to do it, Becky. I enjoyed it. And it's really great to see you. I can't wait to see you in person one of these days.
I know, hopefully soon. Thanks again, Eric.
Take care. Bye-bye.
Bye.